Hello everyone, you're watching PHYSIOCLASSROOM channel, and in this video of BRUNNSTROM therapy series, we are going to learn about the important hand reactions and various steps of hand function recovery in a hemiplegic patient. Now it has been observed that following hemiplegia, the hand function recovery takes place in a manner that closely resembles the evolution of the grasping functions of a human hand. So in a hemiplegic patient also, we see that first there is appearance of reflexive finger flexion movements and reflexive grasp reactions, followed by which it gradually matures into a voluntary grasp and release functions. Following hemiplegia, there are 7 important steps that have been outlined in hand function restoration. So let's discuss them one by one. In the first step, the physiotherapist is going to find that following hemiplegia, the upper limb that was flaccid will start demonstrating hyperactive tendon reflexes. That is, the tendon reflexes will reappear and will become exaggerated. This is the first step in the hand function restoration. In step 2, the spasticity starts developing in the paralytic upper limb, and now the physiotherapist can characteristically feel the resistance that is being offered to passive movements. This is so because of the muscle stretch reflex becoming hyperactive. In step 3, the hemiplegic patient can now demonstrate voluntary finger flexion only if facilitated with a proprioceptive stimuli like a quick stretch. So in this stage, the patient on his own will not be able to produce any finger flexion movement, but if a therapist gives a quick stretch to the paralytic hand, then the patient will be able to produce a voluntary finger flexion movement. This is the characteristic of the step 3 in the hand function restoration. Step 4 in the restoration of hand function is characterized by elicitation of the proprioceptive traction response. Proprioceptive traction response is also referred to as the proximal traction response. In this, if a physiotherapist delivers a quick stretch to the flexor muscle of any of one joint of the hemiplegic upper limb, so it can be a quick stretch to the flexor muscles of the shoulder or the flexor muscles of the elbow or the wrist, then this is going to result in a reflexive facilitation of the flexor muscles of all the other joints, and this can often result in the total shortening of the hemiplegic upper limb in the flexor direction. Now interestingly, it has also been found that the proprioceptive traction response can be influenced with the neck righting reactions like the asymmetric tonic neck reflex. Keeping the head and neck of the hemiplegic patient rotated away from the paralytic upper limb is going to increase the flexor tone, and as a result, the proprioceptive traction response is going to get facilitated. Similarly, rotating the head and neck towards the paralytic side has shown to inhibit the proprioceptive traction response due to a reflexive increase in the extensor tone of the hemiplegic upper limb. In step 5 of hand function restoration, the hemiplegic patient can now control voluntary finger flexion movements even in the absence of the proprioceptive stimuli. So this means the patient is now no longer dependent upon the deliverance of the stretch to produce a finger flexion movement. In step 6, the spasticity starts declining and the patient's grasp is greatly reinforced by a static tactile stimuli in the palm of the hand. So in this stage, the hemiplegic patient is able to produce a strong flexor grasp from the hemiplegic hand when a tactile stimuli is given on the palm. However, the patient is still unable to control or facilitate the extensor movements and finds it difficult to release the object. Step 7 in the hand function restoration is characterized by elicitation of the true grasp reflex. In this phase, the spasticity further declines. A true grasp reflex can be elicited by a distally moving deep pressure stimuli over certain areas of the hemiplegic hand. So like you can see here, I have drawn the area that is responsive to a true grasp reflex. So when a deep pressure stimuli is moved in a distal direction, it is characterized by a reflexive contraction of the MCP and the IP joints. Giving a proximal deep pressure is not going to elicit any response, and similarly, as you can see here, these are the areas, especially the hypothenar region and the lateral part of the thenar region, where we cannot elicit a true grasp reflex. It has also been seen that a deep pressure stimulation in the palmar dorsal direction invokes a reflexive adduction movement in the neighboring digits. Now, true grasp reflex has two phases. The first one is the catching phase, in which when the deep pressure stimuli moves in the distal direction, we see a reflexive weaker contraction in the flexor muscles of the MCP and the IP joints. If immediately after invoking the catching phase, the therapist goes for a quick stretch to these muscles, then the patient can produce a stronger grasp from the paralytic hand, and this is known as the holding phase of the true grasp reflex. So these were the 7 important steps of hand function recovery in a hemiplegic patient. Now if we emphasize upon the step 1, 4 and 7, we can appreciate that in step 1, when there was appearance of deep tendon reflexes which started becoming exaggerated, it was a monosegmental spinal cord reflex activity. So we need to correlate these developments with the Brunnstrom's reflex control and hierarchical control approach. So now we have the lowest most center becoming activated. In the step 4, we saw a proprioceptive traction response, which is a polysegmental response mediated by a higher center above the spinal cord, that is the brainstem. Now followed by this, in step 7, we saw the elicitation of the grasp reflex, which is a subcortical response. So now we have the control of this activity even at a higher motor center. Now Brunnstrohm also mentions another important hand reaction, which is known as the instinctive grasp reaction, which is mediated at the cortical level. Now instinctive grasp reaction is somewhat similar to the step 6 of the development of the hand functions, which was the grasping in response to a static tactile stimuli. The only difference is that in instinctive grasp reaction, the patient has developed control over the voluntary finger flexion and extension. That means the patient can grasp and release, but when a static object is placed in the palm, there is a reflexive grasping of that particular object, and patient finds it difficult to release that particular object. Finally, there is inhibition of this instinctive grasp reaction, and the hemiplegic patient gains complete control over the voluntary grasping and releasing functions. So this is how the hand function restoration takes place in a stroke or a hemiplegic patient. The hand reactions described in this video can be utilized by physiotherapy students and practitioners to facilitate hand function recovery in hemiplegic patients. In the next part of Brunnstromm therapy series, we will be talking about the 7 important stages of hemiplegia recovery as described by Brunnstromm. So see you all in our next video. Till then, keep learning, keep sharing and stay connected.